Welcome back. In our last video, we were working on cervical retractions. We were working on bringing the head and neck back to improve the upper neck and shoulder posture so we can look better, feel better, move better, and ultimately heal better our spine against different injuries. What I want to work with today is that same type of cervical retraction from a different position, this time from what's called the quadruped. So I'm going to go ahead and get myself set up on hands and knees, which would be called quadruped position. And if you notice, what I'm going to try to do here is get my knees underneath my hips, my hands underneath my shoulders, so I'm looking like a nice proper box from the side angle view. From there, what I want you to think about doing is reaching your head forward as far as you can to the ground. That's the position we ultimately want to avoid. Then reversing that position and retracting your head the same way with length of your spine. Many of us have been in this position before and have done something similar to this, known as a cat-cow or a spinal flexion and extension exercise. I love that exercise, and we can utilize that as a way to start to get the neck moving, but I really want to get this head and neck moving back initially. So 10 cervical retractions. When we're done with those 10, we're going to stay in this position, and we're going to do 10 scapular push-ups from the quadruped. In this position, our focus is going to be keeping your arms and elbows straight and bringing your shoulder blades back to touch, known as a retraction, then subsequently protracting or reaching our shoulder blades forward. We have to get our shoulder blades moving over our rib cage if we want to be able to keep our upper back open and extended. Otherwise, you end up with this very rounded elderly posture, and it's very hard to get out of that position over time. If that is too difficult on that quadruped to find that range of motion, very, very simple modification we can do is use a wall. You're going to be simply putting your hands against the wall like this. Let's see if I can make this a little better. Simply going to put your hands against the wall. Think about organizing your spine a little bit. So I don't want you to keep this big arch here. Think about tucking and locking in a little bit from your midline. Again, like somebody's going to come and give you a little tap and you go, and you're bracing down. So we're going to be nice and straight. Little bit of a brace and a tuck. You can see that change with my pelvis. And then simply bringing my chest close to the wall and pushing away. So here's the retraction of the shoulders, and there's the protraction. That is a scapular push-up against the wall. You can also do it with no resistance, just standing, and work on trying to feel the motion, just the motion with your arm. That's allowed. There's no rules here. Again, we just want to be able to generate this motion in a safe and effective way so we can start to repair the kinetic chain from your shoulder up into the neck and eventually the upper back if that's been implicated as well. Cheers, happy moving.